Hello and welcome back to Path to Nursing. Are you preparing for the NCLEX-RN? You're in the right place. In today's video, we'll cover 10 original NCLEX-style obstetrics practice questions on preeclampsia and eclampsia, one of the most important and frequently tested topics on the NCLEX. Read each question carefully, pause the video if you need more time, choose your best answer and then stay for the detailed rationale to strengthen your clinical judgment. Question 1. A pregnant client at 34 weeks gestation reports a severe headache and blurred vision. Which action should the nurse take first? A. Encourage the client to rest. B. Assess the client's blood pressure. C. Offer oral fluids. D. Reassure the client that these symptoms are normal. Correct answer, B. Assess the client's blood pressure. Rationale: a severe headache and blurred vision are warning signs of preeclampsia. The nurse should immediately assess blood pressure to determine the severity and guide further interventions. Question 2. Which assessment finding is most consistent with severe preeclampsia? A. Blood pressure of 118/72 mmHg. B. 1+ pedal edema. C. Blood pressure of 168/110 mmHg with proteinuria. D. Fetal heart rate of 140 beats/min. Correct answer, C. Blood pressure of 168/110 mmHg with proteinuria. Rationale: severe hypertension with proteinuria is a hallmark finding of severe preeclampsia and requires prompt management. Question 3. Which medication is commonly administered to prevent seizures in a client with severe preeclampsia? A. Oxytocin. B. Magnesium sulfate. C. Terbutaline. D. Betamethasone. Correct answer, B. Magnesium sulfate. Rationale: magnesium sulfate is the medication of choice for seizure prevention in severe preeclampsia and eclampsia. Question 4. While caring for a client receiving magnesium sulfate, which assessment finding requires immediate intervention? A. Respiratory rate of 10 breaths/min. B. Blood pressure of 146/90 mmHg. C. Heart rate of 88 beats/min. D. Urine output of 40 milliliters per hour. Correct answer, A. Respiratory rate of 10 breaths/min. Rationale: a respiratory rate below 12 breaths/min may indicate magnesium toxicity and requires immediate action. Question 5. Which laboratory value is most important to monitor in a client with preeclampsia? A. Platelet count. B. Blood glucose. C. Calcium level. D. Thyroid hormone level. Correct answer, A. Platelet count. Rationale: a low platelet count may indicate worsening disease or HELLP syndrome, a serious complication of preeclampsia. Question 6. A nurse is caring for a client with severe preeclampsia. Which intervention is appropriate? A. Maintain a quiet, low-stimulation environment. B. Encourage vigorous exercise. C. Restrict all fluids. D. Place the client in the supine position. Correct answer, A. Maintain a quiet, low-stimulation environment. Rationale: reducing environmental stimulation helps decrease the risk of seizures. Question 7. Which finding indicates that magnesium sulfate therapy is effective? A. The client remains free from seizures. B. The client's blood glucose decreases. C. The fetal heart rate increases to 180 beats/min. D. Proteinuria completely disappears within 1 hour. Correct answer, A. The client remains free from seizures. Rationale: the primary purpose of magnesium sulfate is seizure prevention, not blood pressure control. Question 8. A client with preeclampsia reports epigastric pain. What should the nurse suspect? A. Indigestion. B. Liver involvement and worsening disease. C. Normal pregnancy discomfort. D. Urinary tract infection. Correct answer, B. Liver involvement and worsening disease. Rationale: epigastric or right upper quadrant pain is a concerning sign that may indicate liver involvement or HELLP syndrome. Question 9. Which nursing action is the highest priority during an eclamptic seizure? A. Protect the client from injury and maintain the airway. B. Insert an oral airway immediately. C. Restrain the client's arms and legs. D. Offer water after the seizure begins. Correct answer, A. Protect the client from injury and maintain the airway. Rationale: during a seizure, the priority is to prevent injury and maintain a patent airway. Do not place anything in the client's mouth or restrain them. Question 10. Which assessment finding requires the nurse to notify the healthcare provider immediately? A. Deep tendon reflexes are absent in a client receiving magnesium sulfate. B. Mild ankle edema. C. Blood pressure of 128/78 mmHg. D. Fetal heart rate of 145 beats/min. Correct answer, A. Deep tendon reflexes are absent in a client receiving magnesium sulfate. Rationale: absent deep tendon reflexes are an early sign of magnesium toxicity and require immediate assessment. The provider should be notified, and the antidote, calcium gluconate, should be readily available. Don't forget to like, subscribe, and turn on the notification bell so you never miss a new NCLEX practice session.